All right, finishing up chapter 9 as we talk about the different ways of administering medications and how to properly handle them in the OR. Same learning objectives that we covered in the last recording, but now we're going to start on pretty much number 6, talking about the things required on the drug label. We'll talk about the drug handling supplies, needle stick acts, roles of the surge tech and the circulator, and then the proper labeling and transferring within the OR. So first of all, the laundry list of things that are required to be on the drug label and the package insert, which is incredibly long. So the indications and usage, again, indication is why the drug is being prescribed. The dose and the administration, so is it oral, IV, etc. The dosage forms and strengths, so the concentration. So again, if it needs to be diluted or reconstituted, it gives you the concentration so that you can then calculate out the correct dosage. Contraindications, again, reasons why the drug should not be given, like pregnancy or heart conditions. Warnings and precautions, any adverse reactions, again, those are the very harmful kind of side effects. Any drug interactions, if it's known to be antagonistic or agonistic with another, when taken with another drug. Use in specific populations, sometimes there are different ethnicities that react differently to the drug. What happens or the dose at which an overdose occurs, so what are the signs and symptoms to be watching for? And then any information about the abuse and possible dependence, including how to diagnose that, is included. And then finally, just the description of the drug itself. A few more things to add to this crazy list. The clinical pharmacology, which is how the drug works, so like the pharmacodynamics and kinetics. Non-clinical toxicology, so again, at what dose does it become toxic, and what are those symptoms that can include like carcinogenesis, which means it can lead to cancer, can lead to mutations, can damage the reproductive system. Information about the clinical studies, any references about the drug in research, and then how the drug is supplied and stored as well as handled. And then finally, just like patient counseling information of what should be communicated to the patient. All right, so in the last video, we talked about the different packages like ampules and vials and all that kind of stuff. This time we're focusing on the handling supplies. So how it's stored, different supplies for storing it, measuring it, transferring it, administering or giving it, and then just conveying the drug to the sterile field. So how do we get these drugs properly handled in the OR? So some of the types of these are syringes. So again, drawing up solutions from vials or ampules and then transferring them to the patient to administer them. Needles are important for that. Droppers for that installation method. Metals, plastic, and glass containers, and infusion pumps, so like those solution bags. So starting first with syringes, one of the most common ones we're familiar with. These are usually transparent so that we can view the volume. Again, cc is the same thing as a milliliter. Most of the time, both of those are listed on the syringe. Again, milliliter is preferred. Now, when do we use syringes? This can be used to transfer medicines from the container to the patient, again, like from an ampule or a vial to the patient. Just moving it from one location to another, especially transfer syringes, again, with that filtered tip where we're sucking up the solution from the ampule and then inserting it into something else. Using it for irrigation, so just washing out or flushing a tissue. Withdrawing air or fluid from the body. Inserting air or fluid into the body or some type of device, kind of flushing out tubing, for example. So these are sterile and most are disposable that you'll come in contact with, though they do make reusable syringes. Now some of the parts to the syringe, so of course the needle for administering most of them, there's a Lurlock hub, which is where that needle can twist in. Where the contents actually go is called the barrel. And then there's a rubber plunger at the tip of the stopper, just to create that vacuum and to determine the volume. Kind of the overhang there is called the flange. And then what goes down inside to actually draw up or push out the solution is called the plunger. And then there's another flange at the end of that as well, which is for the gripping. So more about the syringes and different types. So they're slip tip, and unlike the picture we had just looked at, so they have a tapered end that fits into that needle hub, but it doesn't actually twist in. So the slip tip just slides on, so it stays in place by friction. So therefore it can more easily become dislodged. Now the picture that we had just seen was the Lurlock, which is the trade name, also called the twist tip. And that's just because the tip is threaded, kind of twisted onto the syringe, and then the collar with the grooves, so the needle twists into it. And these are going to be much more stable than the slip tip. We also have the centric, so center, and then E means like off, so it's off-centered tip. So this is whenever the syringe needs to be parallel to the injection site. So if you remember, intradermal going into the skin is almost perpendicular to the skin. So a normal tip is hard to make that angle. So the eccentric is kind of off center, and it allows for that intradermal injection more easily. Then a control syringe. This one, instead of those phalanges, actually have, or phalanges, actually has 3 finger rings, and these are really common in dentist offices, so you may have seen them before. So 2 of those rings are attached to the barrel and then 1 to the plunger, and just sliding your fingers in there and gripping just provides more stability and can allow for more pressure to be applied. We also have irrigating syringes, so this would be for irrigating a wound or aspirating or taking off fluid from the wound. These are made of specialized, biocompatible, non-toxic plastic, so that it's not transferring anything into the patient during the flushing. So a few different types of irrigation syringes. We have catheter tips, large bulb, ear syringes, and TUMI, and we'll talk about each of those. All right, so the first one, the catheter tip. So this has a large blunt kind of tapered end that's larger than the slip tip, and that's going to allow air and fluid to be inserted or withdrawn, and it can actually be used by itself. Now the large bulb or asepto, this is almost looks like a baster, so this is, as it implies, a larger bulb at the end for washing or inserting, even withdrawing fluids from large wounds or orifices. That catheter tip can also be used as a barrel, so it has a barrel and a bulb, and it uses that catheter tip at the end. And the bulb can become loose or dislodged, so it's important to make sure you have good control of it. So again, also be sure there are not obstructions that would block the tip, so it's not actually getting solution into it. And then also it's important to avoid expressing any of the solution because it's more using suction, so therefore it's easier for that to kind of drip out. Ear syringe, this is a single unit, usually has like soft plastic with a bulb at the end, so kind of a much smaller baster like the Asepto, but then again, just much softer, much smaller. This is used for irrigating and aspirating smaller wounds. So we have a large bulb for larger wounds, the ear syringe for smaller. Then the TUMI is very specialized. It's used for urological surgical procedures. So within the kind of within the kidneys and the urinary tract is where you would be using these specifically. So the tip may be removable, and it's even smaller than that catheter tip, but it has a double phalange on the end of the barrel to help secure it in place and to help with that grasp. And then this is just showing some of the different needles that we can have. So of course the plastic sheath. At the very tip of that is what we call the bevel, where it's opened there, and then the inner opening is called the lumen, with our point there, and then the hub is actually where it's attaching to the syringe. So a few more needles here. So hypodermic, these are the most common needles. These are for injecting regardless of the type of injection. There are intravascular needles that are with or without that catheter. We have spinal needles and blunt needles. So the blunt ones are not going to be sharp at the end. Instead, those would be used for filling a syringe, so again, transferring it, or for irrigating a wound. So it's not sharp, it's not penetrating, but again, it's used more for collecting or filling that syringe or irrigation. Now with these needles, we talk about the Needle Stick Safety and Prevention Act, one of our other laws, more recent than the ones we covered earlier in our chapters. So this does require written exposure control plan that includes identification of at-risk employees, so who's most likely to get stuck by a needle. So this would include like the janitorial staff as well as healthcare providers. Communication about hazards and injury prevention, so the individuals need to be trained. Provision for hepatitis B prophylaxis, again meaning ahead of time, so most hospitals require hepatitis B vaccination before you can work there. This is why. Implementation and precautionary measures have to be in place, and you have to show that you are actually using them. Maintaining records for all sharps injuries, so if there is a needle stick, that has to be well documented and that record maintained. And then finally, just re-evaluating all those incidents in which there is a needle stick. All right, so back to our devices here. So we also have droppers that can help instill, again, installation is dropping liquid onto a surface. So that instills liquid medications into the nose, ears, or eyes. It can also be used for measuring small amounts of medications to add to another one, or even to insert into an infant's mouth because it's so much smaller. And these are pretty much like the bulb syringe. So again, we have the tapered end, but at the other end, we have that bulb there to control what's being administered. And it has a plastic or a glass barrel with that tapered end I just mentioned. Now the bulb is then attached at the opposite end to that tapered end. Now different containers. So these mainly vary based on size. So the large bins typically have the sterile water. Medium is for those irrigation fluids. And finally, the smaller ones are going to be for the medications. Now it's important to measure using the meniscus, and I'll try to draw this. But if we have, say, some type of cup or something that's here that I just drew, whenever you pour solution in, it doesn't go straight across. Instead, it kind of is concave like this. So whenever you hold it up at eye level, it's going to look more like this U kind of shape that's here. So the meniscus is right at the bottom. So that's the line that you want to use. So if you're looking for 1 milliliter, you would want the bottom there of that U to be on the 1 milliliter line, not the top that's here, because then it's actually a little bit more than what you're supposed to be giving. So make sure that you use the bottom of that meniscus to measure properly. All right, we also have graduated pitchers. So these are marked with calibration, so we know approximately how much fluid we are adding, and those are used to pour the contents into the surgical wound. So using, instead of an irrigation syringe, we're talking large wounds, so we need to actually pour it onto it. Typically, these hold about 1 liter. All right, then much smaller, we have our medicine cups. So these are for small amounts of liquid. They are, again, calibrated with milliliters so that they can be used to measure out the contents. Our infusion pumps, so these can be programmed to deliver solutions at a specific flow rate. So these would be like hooked up to an IV bag. So they administer the fluid from the solution bag or syringe to the patient. So optional features can control temperature of the fluid in addition to the flow rate. And then some have patient-controlled analgesia devices, so typically with morphine after surgery that allows the patient to self-administer the pain medications instead of that constant flow rate. And this is just showing an example here of one of those. Then we also have an intrathecal, so that's referring to the spinal tube, and again we have a pump. So this delivers medicine to the spinal cord via this cerebral spinal fluid. So it's using that fluid to get medications to the spinal cord. So the catheter is inserted in what's called the subarachnoid space that goes around, kind of the meninges layer that goes around the cord, and it's connected to the pump that is actually implanted into the abdomen. And that pump is pre-filled with medicine, so it's going to consistently be delivering the contents of that to the wound or to the site. And it also can be refilled by injecting through the skin into the pump. And then the battery for these typically lasts 3 to 5 years, and then they would need replaced. Now, whenever it comes to getting the field ready, the medication prep actually happens in the non-sterile area of the OR. So this is prepared by the non-sterile team member in the non-sterile area, so that all makes sense. So local anesthetics may be injected prior to the performance of skin preparation. And then reconstitution of a medicine also happens in that non-sterile area, and that medication used by the anesthesia provider is stored in the non-sterile area, and then finally the medication to be later transferred to the sterile field. All right, so our transfer here to the sterile field. So the circulator and the surge tech. So in these surge techs can take on the role of the circulator, but they would be considered the non-sterile member. So they're the ones getting the drug from the storage location, whether it's the hospital OR or one of those satellites, or the hospital pharmacy or one of those satellite pharmacies. They're going to perform the first verification because they're taking it from the storage location. They're going to prepare it for transfer to the sterile field, maybe by creating labels or getting the correct equipment for that. And then they approach the sterile field with the drug and help provide the second verification. The surgical tech duties and responsibilities, they're the one who is requesting the drug from the circulator. The circulator actually gets the drug. Sometimes they're involved in the first verification, but not often. And then they also watch for any breaches of the sterile technique, help prepare the drug receptacle, just what's receiving it, whether it's a medicine cup or a syringe or whatever, within the sterile field. They perform the second verification, and then they receive the drug into the sterile field. So they are collecting the drug. Surge tech is also involved in that third verification right before it goes to the patient. They're the ones labeling everything. So even if a drug is going from a vial to a syringe and then to the patient, that syringe needs to be labeled. Also, they're going to announce the name and strength of the medication every time that it gets passed, and monitoring the patient for any unexpected reactions. And finally, keeping track and reporting on the total amount of the drug used so the circulator can document that. And then discarding any unused portions. Talking more about this labeling and how that happens. So first of all, what do you use to actually label? So the device is used to label. So sterile marking pens and also blank adhesive labels are commonly used to write down what drugs are. There are customized pre-printed sterile labels that can be used, and medication labeling kits. Now all of the containers must be properly labeled. And that includes having the name and strength must be verbally identified by the individual that it's being passed for. A few things here. So first of all, we can see this labeling pin that's here by the labels. And we can see that labeling has happened on all of these containers that have this medication so that everyone's aware of what it is. There's some pre-printed labels over here that can be used as well. There are 3 different ways of transferring that medication to the sterile field. So one is using a syringe, so drawing it from a vial and then giving it to the surgical tech that then administers it. It can be accepted into a sterile container, so that sterile container is placed in the sterile area, and then other contents can be poured into it. And then expressed from the tube or packet, so again, these have solids or semi-solids in them that need to be removed. So the surge tech is removing the outer covering from those tablets or capsules that can then be placed in the hand of that non-sterile individual.